So I hope my audio and video are clear to you. Now what we study here, that whenever you have to read this, okay, your right side will be the right eye and your left side will be the left eye, right? So you, in the perimetry, you have to read this as a right eye and this as the left eye you have to read, okay? So this is temporal, nasal, and temporal. So some of the people said that they had asked that what lesion it is, and some of them have said that they had asked whether it is heteronemus or homonymous. So we will do it both ways. Now because here the blindness is present on the temporal side of both the eyes, right? So it is actually bitemporal. Therefore, I can say that it is bitemporal hemianopia. This is very, very clear. Okay. Now, if I am saying that it is bitemporal, now look at the sides, guys. This is the right side. Then this is left side. Then this is right side and this is left side. ठीक है? So which side of both the eyes are getting affected? ये देखो, bitemporal, मतलब temporal of the right eye and temporal of the left eye. Now though it is field wise same, bitemporal of both the eyes, but if you look at the side, temporal field of my right eye is on the right side and temporal field of my left eye is on left side. So right side of right eye and left side of left eye is affected. तो इसको क्या बोल देंगे? Therefore it will be called as heteronemus hemianopia. तो वेरी वेरी क्लियर कट है. हेट्रो मतलब डिफरेंट, नेमस मतलब साइड, डिफरेंट साइड ऑफ बोथ द आईज इज गेटिंग अफेक्टेड. तो ये हमने बहुत बार किया है, प्रेजेंट इन आवर नोट्स. पूरा का पूरा विजुअल पाथवे स्टार्टिंग फ्रॉम द ऑप्टिक नर्व, देन वी हैव ऑप्टिक काइज्मा, लैटरल काइज्मा, देन वी हैड ऑप्टिक ट्रैक्ट, लेटरल जेनिकुलेट बॉडी, ऑप्टिक रेडिएशंस एंड विजुअल कॉर्टेक्स. तो आई थिंक बहुत ही बार करा हुआ टॉपिक है. हमने कितनी बार क्लास में और लाइव ऐप पे, ये गुरुकुल में, सब जगह ये क्वेश्चन डिस्कस किया हुआ है. और इफ यू रिमेम्बर, मैंने बोला भी था कि सबसे ज्यादा जो पूछा जाता है वो ऑप्टिक कियाज्मा का ही पूछा जाता है, द हेटेरोनिमस हेमिएनोपिया. नाउ हु विल टेल मी द एग्जांपल? One of lesion and in one vision was asked. Okay, so there were two questions. तो even better है, I think ये वाला भी आया था इस पर. A patient presented with the visual field, और दोनों में ही bitemporal hemianopia था, और उसमें उन्होंने पूछा था that which kind of lesion. तो अगेन ये right side of right eye है and left side of left eye है. तो it is actually heteronemus hemianopia. Now I could get you कि दोनों questions थे और दोनों क्वेश्चंस में सेम बाइटेम्पोरल हेमिएनोपिया था. एक में लीजन पूछा था एंड इन वन दे हैड आस्क्ड दैट इट इज हेटेरोनिमस, एंड वी हैव डन दिस सो मेनी टाइम्स. नाउ कैन यू टेल मी दैट व्हाट इज द एग्जांपल? सी, deliberately I have taken here as a fill in the blanks. So where do you get the lesions of optic chiasma? क्योंकि ऐसा वाला clinical question भी आ सकता है, as I told you in the classes also, कि pituitary tumors, right? Pituitary tumors are mostly responsible for causing this bitemporal. So what is the example? It is the pituitary lesions. Okay, whenever we are having the pituitary lesions, we can have the optic chiasma. Example में you can have the pituitary adenoma, we can have pituitary adenoma, or we can have craniopharyngioma. We can also have the craniopharyngioma. So whole of the visual pathway, I think one day before also, when I told you all the important things that you need to revise on the last day, that day also I told you about the visual pathway and the optic chiasma lesion. So I think again we have nailed it, and we were able to predict the topics that actually will come. All right, so this is clear. One more question where the patient has upper and lower loss of the right side of the eye and right side of the left eye with the macular sparing. Okay, so we will come to that macular sparing also. वैसे macular sparing can occur in which lesion? चलो macular sparing की बात करते हैं. Somebody is saying that there was a question on the macular sparing. So in the lesions, where do you get the macular sparing? When you show the lesion as the blood supply, along with the blood supply, means if I talk about the vascular lesions, something like this, I can divide this into two parts. Now here I am showing the right-sided defect. Because I am showing the right-sided defect, so blindness I will show on the left side. Okay, so this is the right eye field and this is the left eye field. So I will show the blindness on the left side, something like this and something like this. Okay, right, very correct, Mayank. So in the occipital lobe, now specifically in the occipital lobe, lesions of what? It will be the lesions of the visual cortex. Whenever we are having the lesion of visual cortex, we can have this macular sparing. Now what is the cause of it? It is actually the blood supply. So what I told you in the classes also, what is the blood supply of visual cortex? Visual cortex lies in occipital lobe, right? Now occipital lobe means posterior. Remember your circle of Willis. We have anterior cerebral artery, we have middle cerebral artery, and then we have posterior. Now posterior cerebral artery, therefore blood supply will be by posterior cerebral. Therefore, posterior cerebral artery. Now, posterior cerebral artery supplies all of the visual cortex in the occipital lobe. But why we have sparing of macula? Come on. So, M for M हमने याद किया था. M for macula is also supplied by middle cerebral artery. So, we have middle cerebral artery along with the posterior cerebral artery. ठीक है? याद है ना? M for M. Macula is also supplied. I think occipital lobe was an option. Not a problem. Occipital lobe was an option. That also is correct. Visual cortex is an option. That is also correct. तो occipital lobe भी हम लिख सकते हैं यहाँ पे. Visual cortex or the occipital lobe, not a problem. ठीक है ना? Now, if I am having the lesion of posterior cerebral artery, तो क्या होगा? If I have the lesion of posterior cerebral artery, then the peripheral area will get blind. Whole of the area which is supplied by this posterior cerebral artery will become blind, while the area which is supplied by the double blood supply, that is having the supply from middle cerebral artery as well as the posterior cerebral artery, that will continue to have vision. So, see, peripheral area is gone blind and the central area will continue to have vision. Actually, this is called as macular sparing. So, whether they showed up and down also or they showed only the quadrant, if I am having macular sparing, then it is always due to the lesions of visual cortex or it is due to the occipital lobe, and the reason is the double blood supply. Another important question which they can ask on this is that it is due to the double blood supply. So I hope it's clear now. So I think there are 3 good questions from visual pathway, and that is what I told you, that sometimes they can give you even more than 1 question from a topic. Like they did this in 2018 also. There were 3 questions from pterygium. There were 2 questions from conjunctivitis. So ऐसा भी होता है, right? So I think this is very clear. Macular sparing वाला हो गया, heteronemus वाला भी हो गया, as well as the lesions of optic chiasma. Any modification required in any of the questions? So we have done 1 question, 2 question and 3 question. 3rd question is on the macular sparing. ठीक है ना? 3 questions हो गए.